Yeah, so there is a fair amount of activity in the sickle cell space right now, and the ones that are particularly exciting are to do with sort of disease-modifying treatments, new agents that have come through, and also gene therapy, which is a curative treatment. So when it comes to the disease-modifying treatment, there are a number of different molecules that are being investigated. So one of them is the pyruvate kinase activator. And so there are a couple of molecules that are being investigated right now. So etavopivat, mitapivat are the two that is being investigated, and some really promising results are coming through. So the idea is that with using these molecules, the red cells are then enriched with ATP, which is the energy molecules, as well as allows the oxygen to be, to be better held because of the increased enzyme activity. So which then means that if there's not so much lack of oxygen, it means that the sickling is less as well. So you're seeing both less sickling as well as increased sort of boosting of the red cell energy, which will hopefully translate into people being less anemic, but also having less sickling and therefore less pain. So that's the idea. And these are oral agents, they'll be probably easy to administer, easy to consume, and so on. So they're very promising. There's another group of molecules in very early development looking at artificially reducing the iron levels, systemic iron levels. So that is something, it's very early stages of development now. And because it's felt that reducing the systemic iron levels is better for sickle cell symptoms. The other molecules that have been in the horizon are things like obviously voxelotor is now going through approvals, but the same company has another molecule that is investigating. So there are a few things, and of course hydroxycarbamide, so drugs similar to hydroxycarbamide, in other words, drugs that are inducing fetal hemoglobin production, are also under investigation right now, very early stage, but there might be other alternatives to hydroxycarbamide going forward. In terms of the sickle cell space, of course, it's not as relevant as the thalassemia space, but hopefully there will be some more iron-chelating agents, which we haven't heard of very much at the moment, but there will be transfused sickle patients who will need iron chelation, but I'm not really familiar with anything that's happening right now. Which brings me to gene therapy. And of course, gene therapy is very much the sort of in thing right now. There's a lot of activity in that space, both on the clinical side as well as in the research side. Right now, gene editing through CRISPR-Cas9 technology is perhaps the most advanced when it comes to late phase studies. And right now, one of the gene therapy products are going through approval processes in the UK. Gene addition, which was which unfortunately didn't get marketing authorization, or the company actually withdrew from the European market, was Bluebird Bio, which was a gene addition treatment. But there are other agents currently under investigation. And then there's a sort of next generation gene therapy, if you like, which are looking at gene editing, but in a much more sophisticated way, which does not induce double-stranded breaks. So there's less genotoxicities, which means there'll be less chances that things may progress onto leukemias. There will be, so these are even base editing, where there's really targeting the exact molecule that's problematic. So, the exact base that's problematic in sickle cell. And then the mode of delivery. So right now, the mode of delivery is still very conventional. It's an autologous transplant, which means that the patient needs some myeloablative chemotherapy. And the myeloablative chemotherapy causes a lot of side effects. And so there is a lot of activity in that space to see what is, firstly, can the myeloablation be done in a safer way using safer products? And also, is the delivery of the gene therapy products can be done in different ways, in other ways. such as maybe not doing that, but looking at delivery of gene therapy products in like an injection or in vivo gene therapy and all of that. So there is a lot of potential. So we are just in the beginning of the journey, so it's very exciting.